Good afternoon, everybody. This is Gary Beck, naturopath, coming to you live from the Maximum Wellbeing Thyroid Studio. Today, well, what are we going to talk about? Of course, coffee. Who doesn't love their coffee? Coffee has become a real significant part of our culture in recent years, and of course, its use is perhaps increased in that time as well. So not only can you get a really great coffee these days, but you can get a really great coffee from many places. So it has become a significant player in the days of our lives for many of us. And what we need to consider when we're looking at fertility and pregnancy is, so what is the research saying about caffeine? Now, I know that many of you will not really want to hear it, but unfortunately the science is reasonably conclusive in saying that the maternal consumption of caffeine via coffee or other sources can and does have a negative effect on pregnancy outcomes. So sorry to be the bearer of bad news, but this is just what the science says. And I'm talking about the meta-analysis of quite a few studies. I think the stats are something like 42 studies were part of an analysis that I read recently. 32 of those, so pretty much 2/3, indicated a significantly increased caffeine-related risk in association with pregnancy outcomes. So 10 of them were inconclusive. They weren't saying the reverse of that, they're just inconclusive. So, yeah, it's one of those things where I really encourage all of our clients who are aiming for the best outcome regards their fertility process is to ditch the coffee. Sorry guys, look at alternatives. There are many herb teas, many other beverages that are really satisfying, taste good, and won't have the negative impact that caffeine will. So what are the conclusions of these studies? So they looked at 4 different outcome categories regards to pregnancies. And what it showed is that the risk increased with caffeine consumption in miscarriages, stillbirths, either low birth weight or small for gestational age, and also the risk of childhood acute leukemias. So these are not insignificant things. And it really does tell us that while this has become, caffeine or coffee has become quite a big social thing, even moderation when we're considering pregnancy isn't really the answer. Abstaining completely is going to give you the best outcomes. So that's it from the research about caffeine, and there are great alternatives, and I really urge you to seek them out. Now, the other subject in today's little talk is about polycystic ovarian syndrome. And of course, this is something that unfortunately affects a lot of women. Pregnancy and hormone balance is often a many-factored combination of things. So, of course, we've got healthy lifestyle, appropriate diet, adequate exercise, plenty of rest, and all the rest of it. These are all things that will help to encourage and improve fertility. But with polycystic ovarian syndrome, what I've found in my clinical work is there's a couple of products or supplements or nutrients that have become really mainstays when it's time to help shift the PCOS diagnosis to a better place. And one of the nutrients is a product called MYO-INOSITOL. So we have this available in several different brands, but one that I quite like to use is a powder from Biomedica. And MYO-INOSITOL is a really clever nutrient. It's sometimes referred to as B8 because it has some similar compounds to the B vitamin family of nutrients, but it has the ability to help do a couple of key things, and that is it helps to regulate metabolism and sex hormones in general, but it also helps to support with our insulin regulating. And we know that the PCOS picture often has a blood sugar component relative to what's going on. So this is a really important factor and a really key part of why I tend to use MYO-INOSITOL for these types of patients. It's a simple thing to add in. The powder form they have tastes good, so it goes down well. And because it's helping to improve insulin regulation and blood sugar control, insulin, of course, is a hormone, and when we're balancing one hormone, that's going to have an effect right across the range. So the other hormones, such as estrogen, progesterone, testosterone, are all going to be improved in this sort of hormone cascade. So it's kind of a nice thing. Now, we know that the MYO-INOSITOL can actually improve egg quality as well. So this is pretty big when it comes to fertility and those that are struggling with the non-specific infertility issues. The quality of eggs is very important, of course. So once again, MYO-INOSITOL can help improve fertility, but also help to improve the quality of eggs. It actually helps to improve the production quality. It helps to improve the membrane of the egg itself, so it's more viable and stronger and healthier, and it even helps to stabilize the genetic material within the egg. So these are, as I say, not insignificant considerations, and really is something that when you are dealing with a PCOS condition, I think this is one of those nutrients that really must be in there. So it's just something we need to do. Obviously, PCOS, there are not only blood sugar considerations, but there's also general gut health is really going to impact on this a lot. So we've got the production of neurotransmitters in the gut and a healthy gut that are all part of improving the PCOS scenario through the right signaling in the body and the right triggering of hormones at the right time. So there you have it. So a little bit about caffeine, a little bit about PCOS, and a little bit about MYO-INOSITOL. And I hope you found this helpful. And I look forward to speaking to you again real soon. This is Gary Beck signing out for Conscious Fertility from the Maximum Wellbeing Thyroid Studio. Thanks for listening and have a great afternoon. Bye for now.